Magandang gabi mga kaibigan. Welcome po dito sa ating palatuntunang Radyo Klinika sa DWIZ. Ngayong gabing ito ay tayo po natutuwa kasama po natin ang isa pong consultant ng Department of Health, Office of the Assistant Secretary under the Health Policy and Systems Development Team. Siya rin po ay consultant ng Senate Committee on Health and Demography at siya po ay isa sa mga tumulong kay Senator J.V. Ejercito na mag-preside over a number of technical working group meetings as well as the pre-bicameral preparatory meetings for Republic Act 11223. Isa pong public health epidemiologist, wala po iba kundi si Dr. Troy Gepte. Doc, magandang gabi sa iyo.
Hello Maru, magandang gabi at kumusta po ang ating kalagayan dyan. Hoping that you are staying safe po.
Oo, at professor din po si Dr. Troy dyan po sa New Era University. Doc, kumusta na? Ikaw, kumusta? How are you holding up sa gitna nitong
Okay
ating
naman.
ECQ? Oo.
Oo, maraming pangamba as you know na it's almost been 6 weeks since nag-start yung ECQ natin. And I'm mostly working from home, but I still get to go out pag mag-a-attend ng mga meetings. Usually, I still try to get involved pa rin dun sa response natin for COVID-19. And I try to work with the interagency task force if there's a need to provide some assistance.
So kinokonsulta ka rin nila ng IATF?
Yes. Oo.
Okay.
But by virtue of my work din kasi sa Senate Committee on Health, we also try to help out the IATF.
Okay. So Doc, ano ba ang kaibahan nitong COVID-19 doon sa nakaraang, dumapo rin naman sa atin ito pero hindi nga lang naging ganito ka-massive yung effect, no, yung SARS?
Oo. Noong 2003, nagkaroon tayo ng SARS outbreak in the Philippines, kasabay nung iba-ibang countries. Actually, there were a lot of countries sa Asia, and this really started from yung isang incident of an outbreak in southern China and Hong Kong. Tapos, nakita natin during the course of the epidemic, nung nagkaroon tayo ng SARS multi-country outbreak, marami yung nagkaroon ng kaso at matay. In fact, I think mga around 8,000 cases in all globally, and we had around 800 deaths. So basically mga around 10%.
Yeah.
But itong nakikita natin with COVID-19, medyo grabe ang infectivity nito, no? Mas maraming nahawa at saka talagang globally dumadami pa yung mga namamatay din from this disease. So technically, mas mahirap, mas difficult itong virus na to. They might be from the same family of yung tinatawag ng coronavirus. And actually, ang tawag dito sa COVID-19, the virus that causes it, is SARS-CoV-2 or SARS coronavirus 2. So it's derived from halos the same kind of yung genetic makeup din yung original SARS coronavirus noong 2002-2003.
Okay. Doc, pero hindi naman tayo nagkaroon ng vaccine, di ba, against SARS?
Good question, ano? Actually, they were able to develop a vaccine that was not able to parang yung naibigay talaga sa tao kasi the time nung nagawa na nila yung vaccine, tapos na yung SARS outbreaks. So, hindi na natin na-try out. Ang nangyari, nagkaroon tayo ng magandang control kasi for the SARS outbreak. Kaya hindi natin siya nakitang kumalat pa. There were some few second surge o yung second wave in some countries, pero hindi na siya talaga yung kagaya nung nakikita natin ngayon na talagang laganap siya in many countries and continents.
Pero Doc, bakit noon na-control natin ang SARS? At although 10% yung death niya, no? Pero kukonti lang yun na-infect, kukonti rin lang kung tutuusin yun namatay. Bakit ito na-control natin? Na hindi tayo nag-ECQ, hindi tayo nag-lockdown?
Yeah. Marami tayong nakuha mga information initially about SARS na it can be transmitted by respiratory droplets. Yung usual na kaalaman natin tungkol sa yung pagbahin o kaya yung pagsinga o yung minsan yung pag nagkakaroon ka ng ubo na matindi. Tapos yung respiratory droplets lumalabas yon up to a distance of around 1 to 2 meters away or 3 to 6 feet away. Dito sa COVID-19, itong SARS-CoV-2, maraming mga nakakabigla na mga observations na parang ang bilis-bilis na makahawa nito. So there might be something that might be a little different from what we expected na kung ano nangyari doon sa SARS coronavirus. Ito naman, nakikita natin na baka there's a possibility that even if you are not symptomatic, kung wala kang ubo, o hindi ka bumabahin, or hindi naman talaga yung parang nakakaroon ka ng anything nararamdaman mo or fever, pwede ka makapanghawa.
Tumalsik
Yun
lang yung
kakaiba
laway
dito
mo.
ngayon sa
Oo.
coronavirus.
Tumals
Pwedeng sa
yeah.
pagtalsik ng laway, sa pagsasalita, or yung normal breath natin, baka
Oh.
labored or hard breathing. It will be difficult to prove that actually. Ang nakikita lang ng WHO ngayon, based from some observations or some studies in different countries, pag nasa ospital ka, yung nagkakaroon ng aerosolization,
Yes.
yung nagiging aerosol, yung respiratory droplets, dahil sa yung ventilatory support, yung sa
Yeah.
ventilator machines, or baka yung sa suctioning, pag nililinis yung respiratory tract ng mga na-intubate ng mga pasyente.
Mhm. So, ang sabi mo, Doc, parang sinasabi mo na mas mabagsik itong COVID-19 kaysa doon sa
Yes.
unang SARS.
Yes. Yung pagiging mabagsik sa kanya, yung tinatawag na R0, yung infectivity niya or how efficient it is transmitted, yung isang taong may sakit, pwede siya makapanghawa ng maybe 2 to 3 to 4 times as many people compared dun sa kung ano yung nakikita natin from the SARS coronavirus. So, medyo okay pa yung SARS coronavirus eh. Hindi pa masyadong easily transmissible siya. Pero itong nakikita natin sa COVID-19, kaya siya naging laganap eh. Sobrang dami ang naging
Na-infect
kaso
agad.
natin
Oo.
worldwide.
Multiple kagad yung na-infect.
Yeah. Nagsimula lang kasi siya sa China, I think late December or early January this year. Pero na global spread siya, all countries were put on alert kasi nga there was a tendency for it to go along dun sa mga traveling from China. And then, kung nagkaroon ka ng ganong klaseng exposure or travel history, nagkakaroon ka ng mga small pockets of infection that are small at the start pero dumadami at dumadami siya. So, na-overcome or na-overwhelm ng ating capacity in recent months, in recent weeks. So, may malaking implication yan for our public healthcare system and our hospitals also.
Okay. So, itong COVID-19, sa tingin mo ba, Doc, may pag-asa naman tayong ma-arrest ito anytime soon?
Since na-declare na siya na pandemic ng WHO, from previous experiences natin na nagka-pandemic tayo, the last one was H1N1, and even before that, there were a lot of influenza epidemics or pandemics noong 1918, 1919, noong 1950s and 1960s. It takes some time eh. Talagang months siya before talaga nakokontrol siya. Some nawawala ng kusa dahil dun sa tinatawag na herd immunity.
Yeah.
Pag mas maraming tao na ang na-infect at gumagaling, nakakaroon na siya ng antibodies to protect themselves from yung transmission of the virus. So tayo na mismo nagiging protection or barrier para dun sa mga ibang hindi pa nahahawa ng COVID-19 or nung any virus.
So, hindi ba dapat na ganito na nga ang gawin natin, herd immunity, you let the people out na bawalan lang yung mga matatanda at saka may morbidity ba ang tawag doon? Comorbidity.
Morbidity.
Oo.
Yes. Yung United Kingdom, I think they tried it out initially but they eventually resorted to lockdown o yung mga parang community quarantine na kagaya nun sa atin.
Kasi
Ang
umuwi
Sweden
rin
yata,
yung mga bata sa bahay nila. Oo.
Yes. Yun ang pinakadahilan kasi
Oo.
gala kasi ng gala ang mga bata. Pero pag umuwi sila, pwede lang i-transmit doon sa mga vulnerable like the elderly and also those with comorbidities, yung mga may diabetes, may hypertension, may kidney diseases or cancer. So, yan yung iniingatan natin na sana hindi mangyari. Kaya we have to resort to this kind of restriction sa movement ng tao.
Yeah.
We have to keep them at home or in facilities where they might have to be quarantined for some time. Balimaru, it will take some time talagang may narinig lagi tayo yung tinasabi ng new normal.
Yeah.
Pag nag-lift kunwari ang ating enhanced community quarantine, magkakaroon tayo ng modified quarantine pero limited pa rin ang galaw natin.
Yeah.
It seems that there will not be any yung not much tourism or commercial establishments na magbubukas. pati na rin yung mga schools kasi we need also to protect our children and the families where the children will have to go home to if they come from school na baka ma-infect sila.
Pero Dok, totoo ba na nagme-mutate itong COVID-19? Na may mga bagong
Okay.
strain siya? Oo.
Oo. Yung mga nakita nila dun sa early studies, and this need to be confirmed or validated pa din,
Oo.
is that we have basically three kinds of strains. Meron tayong strain A, B, and C. Yung A, yan yung unang lumabas na strain, but na-overtake siya ng pagkalat ng strain B in Wuhan, China. And it seems like ito yung strain na kumakalat sa Asia. We don't know it. We don't know it yet, pero baka sa Philippines pala, yun din yung strain na kung ano yung galing sa Wuhan, China.
Yeah.
There's this other strain, yung strain C. I think they first saw it sa Singapore and then kumalat siya sa Europe. So, itong dahilan kung bakit nag-mutate yung virus, ang kailangan kasi ng virus is to continuously propagate itself. Yung spread siya ng spread. Pag nakakakita siya ng paraan para mas maging efficient yung transmission niya, ginagawa niya ng paraan para mag-mutate siya, magbago siya, depending on the population siguro where the mutation took place. In the States, yung original na strain na A, yung sa coronavirus, na yung SARS-CoV-2, yan yung kumakalat ngayon yata sa Amerika. Mostly, it's the strain na yung unang na lumabas, yung A. So, kanya-kanyang paraan ngayon para matuklasan natin kung ano yung similarities or differences nila in terms of its infectivity, kung ano yung death rates. Ang virus din pala kasi dahil sa nag-a-adapt siya, nag-mutate, either pwede siyang mas maging transmissible, madali siyang makapanghawa, or mas matapang yung virus. Pag matapang yung virus, pwede siya mag-cause ng more severe na illness. So, yan yung mga natin, ino-observe at nire-record natin to in the different countries.
Oo. Pero paano yon, Doc, kung kunyari iba at ibang strain siya? Tapos kunyari, na-infect ka nung A, pwede ka bang ma-reinfect ng B or kusa siyang nag-mutate sa katawan mo, nagiging B or C siya?
Theoretically, there's that possibility na pwedeng magbago-bago, and then we need to have kung mag-develop tayo ng vaccine, it has to be equally effective against different strains.
Okay.
Kasi ang tinatarget yata ng virus, tinatarget ng vaccine na dinedevelop yata nila is to maybe look at yung tinatawag nilang spike proteins kung naka-envelop sa paligid o sa kabuuan ng virus. Ito yung mga spike na nagbibigay ng pagiging corona niya.
Yeah.
So yun yata yung tinatarget nila sa vaccine. So hopefully that this will be a consistent part of the virus na yun yung tatargetin natin for the vaccine development.
Oo.
So we need to wait for that kind of development. It will take mga around 6 months, maybe 1 year, maybe more, para ma-develop natin yung vaccine. Hopefully better na mas maaga.
Okay. Dok, bakit yung mga na-discharge na, nag-negative na dun sa test, mga after some time, biglang sa susunod na test nila, positive sila uli? Kahit na hindi naman sila lumalabas, naka-quarantine talaga sila. This happened to a patient na ito ang kanyang pinost ngayon, na na-reinfect daw siya.
I think they had this observation, this parang findings from South Korea, maybe one of the first countries to report yung supposed infection. There might be 3 reasons why it's happening. First of all, baka hindi pa talaga
totally na-eradicate.
Na-eradicate. Baka nag-dormant siguro si coronavirus, and then nag-activate or reactivate siya. That might be one way or one reason. Another would be baka yung testing mismo for the patient when gumaling na yung pasyente, tapos for discharge na siya, nagkaroon ng problem doon sa test, yung tinatawag nating false negative.
Yes.
Positive siya pa rin, pero alam mo ba sa test results na negative, may siguro laboratory technical error, or mayroong sigurong yung mismong test are just that good lang. Hindi nila detect na 100% lahat ng mga nagiging positive pa rin. So baka nagkakaroon ng false negative.
Pwede rin false positive.
Pwede rin maging false positive. Kung na-test ka, and then you're supposed to be negative, pero lumalabas naging positive ka, may possibility nagko-cross-react siya with other infections of coronaviruses then. not just SARS but also itong coronavirus kasi is a very common kind of virus that can cause the common cold. So
Mm-mm.
we can't really say how prevalent that kind of infection is.
Okay.
And by the way, Maru, yung
Oo.
third pala possibility
Yeah.
is that yung virus baka fragmented na siya or durug-durug siya, baka
Okay.
nadidetect pa rin yung fragments of the virus nung
Mm-mm.
test. So we can't really be sure kung which of those are the reasons. But ongoing yung study, yung research about how to prove kung talagang yung reinfection is a possibility or it can be easily explained by those three things that I mentioned.
Oo. Papaano ba siya napapatay doon sa loob ng ating katawan para doon sa mga nag-recover na mga COVID-19 patients?
Oo. As in all infections, mga viruses, bacteria, ang body natin kasi may sariling defense, yung immune system natin.
Yeah.
And what we do is activate our cells within the body to produce antibodies. Yung antibodies itself can neutralize the virus para kumonti na siya,
Yeah.
bumaba na siya. Pag bumaba na
Mm.
siya, less na yung nagiging effect niya dun sa body natin.
Mm.
So, as we increase our antibodies, so will our viruses parang mawawala siya from our system.
Mm.
Hopefully, maging continuous ang immunity natin against the virus. We have two kinds of antibodies yung short-term tsaka long-term. Yung long-term sana,
Yan yung
theoretically,
IgG.
it will be possible. Yung
Mm.
IgG, theoretically, it will be possible na pwede siya uh, a year long or maybe more than 1 year. But I think it's also possible that if they develop a vaccine, kailangan may booster shots tayo against this virus. Ang mangyayari parang influenza virus na every year meron tayong bakuna, di ba?
Mm.
Baka ganito na mangyari sa COVID for the next few years.
Okay. Papaano ba inaatake ng COVID yung katawan? Kasi may mga nagsasabi, una raw pumapasok nga yan sa mga nasal passages mo, sa throat mo. Tapos
Yes.
paano siya bumababa dun sa iba pang parte ng ating katawan? At nagmumultiply, paano rin nagmumultiply?
Actually, ang pinaka-primary organ of where it will affect the body, yung sa lungs talaga, sa pulmonary system.
Okay.
As we try to fight the infection, there's a tendency for our body to what you call overreact. May tendency na magkaroon ng overreaction yung ating immune system such that there's so much inflammation, so much edema, so much yung mga processes of infection and inflammation that parang nag-haywire yung body natin.
Mm-mm.
And ang directly na-affect talaga yung lungs natin. They call this the acute respiratory distress syndrome,
Yeah.
where we have our lungs, nakaka-pneumonia tayo due to the virus, and it's so full of fluid. Nalulunod tayo sa sarili nating fluids in our lungs. That's why we need ventilatory support or at least yung oxygen para gumanda yung ating breathing.
Mm-mm.
So that's something that's very common among those who have severe infections.
Yes.
And there's this subset of those na nasa severe infections, tinatawag natin critical.
Mm-mm.
And pag naging critical sila, ito yung kailangan na intubate or gagawa ng more aggressive measures so that
Oo.
we can save the patient.
Okay. Anyway, Doc, yung mga na-discharge na sila, gaano kaya katagal yung kanilang immunity mula dito sa COVID-19?
Yeah. Technically, posible siya na matagal,
Mm-mm.
months or maybe a year or maybe more than a year.
Mm-mm.
We don't know yet kasi it's only been mga 3 or 4 months since lumabas itong pandemic nito, itong virus na to. Before wala kasi tayong immunity against it. But if we are slowly getting more information of how our body reacts and how our antibodies forming
Mm-mm.
and sustaining yung immunity, we'll get to that kind of information eventually in due time. Siguro baka later this year after the first initial studies on yung tinatawag ng immunogenicity
Mm-mm.
for the virus.
Mm-mm.
So medyo we're learning a lot from this virus kasi since it's totally new. Parang may bago tayong bisita tapos kinikilala natin mabuti, kinikilatis natin. And unfortunately, medyo not
Buwisita.
welcome yung visitor na 'to, bisita.
Oo.
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 Kung sana nga makaramdam,
Oo.
sana naman puwede na siya sigurong,
Lumayas.
ah, lumayas
Oo.
kung puwede.
Pero Dok, kanina nabanggit mo nga na ang una niyang sinisira yung lungs. 'Pag ba nasira na yung lungs, irreversible na yun, Dok? Hindi na kayang ma-reverse? Kasi may nabalitaan ako dun sa Paris na kababayan natin Pilipino, ang sabi daw nagdugo yung kanyang lungs kaya hindi na raw na-save.
It's hard to say. Might
Mm.
be from patient to patient, there might be different
Oo.
complications that might set in, and then puwede magkaroon tayo ng, um, yung long term na complications. Puwede magkaroon ng scarring or yung scar or pagsusugat. Puwede magkaroon ng fibrosis. It depends on the outcome of the patient. Kung medyo naging very severe, very critical yung naging condition niya, and they had to pull out the patient, from a very, parang clinically complicated state,
Yeah.
baka dun mag-cause ng complications. But we still have to confirm that as we try to accumulate yung mga data across different countries.
Mm.
Iba-iba kasi ang nagiging, um, parang effect niya sa body. Iba-iba
Mm.
yung nagiging reaction natin to the virus or to the infection.
Oo. So ano ang magagawa natin ngayon, Doc, para mabawasan yung infeksyon or totally ma-eradicate na itong infection na ito sa ating bansa?
Yung yeah, yung national strategy natin has been fixed on being able to determine kung sino yung mga may infection. So among patients who are symptomatic na may exposure or travel history o mga nag-alaga ng mga may COVID-19, and then they have symptoms also, sila yung tinetest natin agad. We
Mm.
also test yung mga healthcare workers natin just for us to be sure that they can perform their duties, they can perform yung kung ano yung kailangan for clinical management of the patients. We also try to test kung sino yung mga close contacts ng mga pasyente na nag-positive, so
Mm.
that we can put them in the necessary quarantine facilities and isolation facilities.
Mm.
Yung pag ikaw ay suspect ka pa lang, or sorry, pag ikaw ay exposed, ang
Mm.
tawag doon quarantine.
Yeah.
Pero kung ikaw ay may symptoms na at napatunayan na by testing, ikaw ay isang positive case,
Mm.
kailangan ka nang i-isolate para hindi ka na makapanghawa sa iba.
Mm.
So, we have these facilities sa LGU, we have these facilities also sa mga, yung DWIZ facilities gaya ng mga PICC, Ninoy Aquino Memorial Stadium. I think pati na rin sa Philippine Arena, meron na rin tayo mga quarantine facilities na nakaset doon. So that
Oo.
tatanggalin natin sila from their residences, from their homes,
Mm.
para hindi nila mahawa yung mga pamilya nila or mahal nila sa buhay. Tapos dadalhin natin sila doon. In so doing,
Mm.
pabababain yung chance or yung risk na magsispread pa siya within our household, within our communities, at dito sa ating mga LGU.
Mm.
Once na magkaroon ka na pala ng mga severe cases dun sa mga na-quarantine o kaya dun sa na-isolate, yan yung dadalhin natin sa hospital for appropriate clinical management. So,
Mm.
nandun yung strategy. Very straightforward siya. Nagulantang lang tayo kasi sa sobrang dami ng mga kaso.
Yeah.
At we're trying to catch up with our backlogs, and hopefully we try to deal with how to protect our healthcare workers, doctors, nurses, and
Yes.
other healthcare workers.
Oo.
Pati yung mga patients with the appropriate equipment, mga mask, mga gown, and all the necessary equipment na kailangan nila.
Mm. So ngayon kung, tayo namang mga ordinaryong hindi tinatamaan pa hopefully na nasa bahay ngayon, talagang malaking bagay itong pag-stay at home natin para mabawasan
Yes.
yung infection.
Yung dilemma natin kasi is that
Mm.
as we are increasing our, nakikita natin pataas ang pataas yung curve of cases natin, yung new cases. Ito yung nasa first wave pa tayo eh.
Mm.
But if we have been effective with this enhanced community quarantine, na mapapaba yung bilang ng dami ng mga bagong kaso,
Mm.
may possibility of a second wave kung medyo maging pabaya tayo dun sa ating kilos, kung
Mm.
saan tayo pumupunta, at yung hindi natin nire-report yung ating mga symptoms.
Oo.
So, ginagawa natin lahat ng paraan para gayahin natin kung ano yung mga good
Practices.
examples or
Yeah.
practices in other countries.
Okay.
Sa South Korea, where they have been successful in decreasing talaga yung number of cases. In other countries, like Germany and maybe some countries in Europe. Pero I just like to take exception dun sa Japan and
Mm.
Singapore. They are experiencing a second wave of cases, kaya they're trying to identify
Kung saan ang
again
galing.
kung saan na naman nagagaling ito, yung cluster of cases, and then go through the same thing all over again,
Mm.
yung identify cases, contact tracing ka, dadali mo sa quarantine facilities, isolation facilities, and titreat mo kung sino yung mga kailangang i-treat. Actually, Maru,
Yes.
dinumero talaga ang gagawin natin eh. Ang problema lang, ito medyo pasintabi sa ating mga kababayan, pasaway kasi tayo, hindi tayo sumusunod sa
Totoo.
mga alituntunin dun
Yes.
sa ating mga panuntunan para magawa natin mabuti itong enhanced community quarantine. Sana, kung mag-lift man, isang criteria yata para ma-lift ito, hindi lang yung sa pagbaba ng kaso, pero kung kaya ba nung LGU o nung barangay na mabantayan mabuti yung kanilang kinasakupan, yung mga
Mm.
constituents nila.
Mm.
So talagang tulong-tulong tayo dito dapat.
Oo. At saka mahalaga yung pagpapalakas ng immune system, ano, Doc? Ano ba ang mga
Yes, yes.
pamamaraan para maprotektahan natin yung ating immune system?
Usually sinasabi natin healthy lifestyle kasi ang emphasis natin
Mm.
sa Department of Health, sa public health. Sa healthy lifestyle, nandun yung pagkain ng tama, sapat, yung well-balanced ang diet natin. Madalas kasi yung ibang tao, pag kumain, yung hindi talaga nila minamind kung may vegetables ba or fruits or enough vitamins and minerals
Yeah.
ang nako-consume natin. Isa pa yung pag-iwas sa mga bisyo,
Mm.
paninigrilyo, pag-inom. Kung sana pwede tayo mag-exercise lagi para
Yes.
mapalakas natin talaga ang ating resistensya.
Mm.
At kailangan natin ingatan ng ating sarili yung stress. Dapat natin yan, ma-address natin yan. Lahat tayo kasi dumadaan sa yung nagiging madamdamin, maraming tayong
Masyado emosyonal.
ikinakabahala,
At
masyadong
natatakot.
emotional.
Oo, natatakot
Oo,
dito sa COVID-19, which will
oo.
add to yung problem nga natin, yung stress natin, at pwede maging
Yes,
dahilan
yes.
nga ng pagbaba ng ating immune system. So, advisable ba, Doc, talaga na pag lumabas tayo, naka-full battle gear tayo? Naka-face mask, naka-goggles ba dapat? Ano ba ang dapat nating
Hindi naman.
tandaan? Oo.
Yung ang for now, very clear ang WHO and the DWIZ is that we try as much as possible to secure yung mga face mask, yung mga bago. There's a tendency for us to reuse kasi yung mga mask.
Ah,
Pag ito ay manipis na o kulukulubot na,
at marumi na.
parang na yan eh, hindi na siya efficient sa pag-filter dun sa kung ano man. Pag marumi na. At saka yung mismong moisture niya, pag naipon na dun sa hininga natin,
Mm.
nagiging inefficient na yung mask para masala niya mabuti yung kung alam mo mikrobyo ang nandyan. The best pa rin yung N95, pero as we mentioned this a lot of times, nire-reserve natin siya sa mga healthcare workers natin so that they have the ample protection.
Mm.
They are most affected kasi mas maraming yung tinatawag ting viral load or
Mm.
maraming virus sa loob ng hospital setting.
Mm.
Pero dito sa community, kung layo-layo naman tayo, may maayos na social distancing tayo,
Yeah.
wala tayo talaga dapat ikabahala. Maliban na lang kung kinalimutan natin yung yung pagsuot ng mask at saka yung
Pero
minsan
kahit anong
nangyayari pa
uri
rin sa
ng
atin
mask, Doc? Kahit anong uri, okay lang?
yung mga blue na surgical mask or
Oo.
face mask that can give parang sufficient protection along with yung mga cloth mask din na ginagawa. I think
Pwede
WHO
rin.
also mentioned na any kind of barrier will be
Mm.
effective kesa wala
Mm.
na
Mm.
tayo barrier.
Totoo.
Yan.
And you were saying, Doc, kanina?
Sorry. I think I was saying something about yung social distancing
Yes.
siguro.
Yes.
Minsan kasi sa mga lugar kung saan may social distancing dapat, kunwari palengke o pila sa grocery o kaya yung mga namimigay sa LGU tapos may tendency magpila-pila, dapat isipin ng ating mga local chief executives kung ano mas makakabuti. Nagbibigay nga natin minsan yung kung anong kailangan nila, yung tulong sa social amelioration program, yung matatanggap nila ng mga pagkain o kaya yung kung anong mga ipapantawid nila siguro sa panandalian ang tendency lang kasi magkupul-kupulan yung mga tao eh.
Yeah.
Kailangan talaga natin paalala lagi sa ating mga officials na mapasunod sana nila ang ating mga kababayan para magkalayo-layo tayo. Yung 1 or 2 meters at least.
Mm.
At yun ay magiging parang klaro para sa atin sa mga susunod na buwan. Baka nga sa susunod na taon, ganito pa rin tayo. Kaya mabuti
Mm.
nang magsimula tayo na mas maganda na mas maaga.
Well, anyway, Doc, thank you so much again at maraming salamat din sa paglilingkod mo sa ating bayan sa patuloy na pakikipagtulungan sa ating mga government officials para mapahinto na itong spread ng COVID-19.
Maraming salamat, Maru, at thanks for this opportunity para maka-share din tayo sa ating mga viewers and mga tagapakinig natin.
Okay, thank you so much, Dr. Troy Gepte. Maraming salamat, Dr. Troy. Bye! Okay.
Bye!
At yan po si Dr. Troy Gepte, isa pong public health epidemiologist na ipinaliwanag po sa atin kung paano ba itong COVID-19 na naging spread nga po at kung ano yung nagiging epekto nito sa ating katawan. Magbabalik po ang Radyo Klinika, makalipas lamang ang ilang paalala.